Hello, I am Jamarcus Brider, a internal medicine second year resident at Franciscan Health in Chicago, Illinois. And I have a pleasure of speaking with today Dr. Dylan Steen, who is the Director of Clinical Trials and Population Health Research at the University of Cincinnati Heart and Lung and Vascular Institute.
Thanks for having me.
Absolutely. So, Dr. Dylan Steen, you did a very innovative study. You and your colleagues conducted a multi-site randomized controlled trial with supermarket and web-based intervention targeting nutrition for cardiovascular risk reduction. Can you tell us a little bit about how you guys came up with this study and what needs that you saw that prompted your investigation?
Sure. So as background, collaborations between academic investigators and industry has been around for decades. And here at ACC, obviously, we're seeing lots of studies being presented where there is a pharma or biotech or medical device sponsor, and the data are being shared. What is in stark contrast is the almost complete absence of rigorous scientific studies with other industries who will become some of the most important industries in healthcare in this coming century. One example of that is retail. And you all know that retail-based healthcare is exploding. It is the future. Name a company, chances are they're building out their healthcare arm. And what we really wanted to do was sort of try to conduct a rigorous scientific study with one of these companies. Now, we had the good fortune to collaborate with the Kroger company. So the Kroger, just so everyone knows, is the largest U.S. supermarket chain, over 2,800 supermarkets, over 2,200 pharmacies, and over 225 retail clinics already. So they're one of the big players in this space. And so SUPERWIN, we looked first at could we improve diet education delivered through a supermarket with all the different things you can harness via supermarket model, the in-store and the online environment, as well as all their purchasing data. And so that's what we decided to do. And so that's what SUPERWIN is. And if you want, I can talk a little bit about the interventions themselves just to sort of show how innovative they were.
Absolutely. We'd love to hear that.
Sure. So there were 3 arms to this trial. The first arm was a control group. The control group just received what we call standard of care, which is a medical nutrition therapy session. It's about 30 minutes. It targets cardiovascular disease. We focused it around DASH diet, and we really enhanced it for this trial. We actually gave participants and their dietitians back their individual dietary intake data. So if I interview you over a couple of days and I get exactly what you're eating and how much and where and so forth, now I'm going to give it to you and your dietitian to work together on your diet. That's pretty cool.
That's incredible.
The second group had that component to it, but also added in 6 separate educational sessions right within the supermarket, teaching in the aisles of the store. And that was all guided by the participants' own individualized purchasing data. So isn't that remarkable? If you and your dietitian could look at an updated profile, what you've been buying, what kind of fruits and vegetables do you buy? How much meat do you buy? How many sweets and junk foods do you buy? And now the dietitian can talk to you about, okay, I see what you like. Why don't we make a tweak here and here? They can personalize it. Because you may like something different than what I like, right? Or you might like spicy and I don't like spicy, or whatever it is. But it's personalized, and these are automatically electronically collected data. So they're available for months to years to come. Nobody has to do anything to provide these. Then the third arm did all of that, but also then added on an online enhancement component. So as part of this trial, these were folks who were not online shopping, but we actually introduced online shopping and taught people how to online shop well. Some people have a very bad experience initially, so we wanted to avoid that. We gave them free home delivery of their groceries, which is important. And then we taught them how to use an app called OptUp, which helps you select better foods. And then Yumly, which helps you prepare better foods, meal plan, build recipes, the whole works. And so we introduced it in a stabilized fashion. So you can almost think of it as Legos, going from something pretty simple to something intermediate to something a little bit higher. So pretty exciting stuff.
Wow. Now let's talk about some of the data that was obtained and you know some of the remarkable findings.
Sure. So just to summarize, our control arm had an increase in DASH score at 3 months. They also had an increase in DASH score at 6 months. So from where they started, they were eating better at 3 months and 6 months. Well, we found exactly the same thing in strategy 1 as well, except the increases were higher. And we found exactly the same thing in strategy 2, which was the fully comprehensive approach, but the increases were even higher than that. It's sort of the intensity of the intervention sort of dictated what the increase in the DASH score would be. So that's pretty exciting stuff. So it not only works, but there's persistence. It's sticky. Then when it came to the two primary hypotheses, it turned out that yes, doing purchasing data guided in-store tours, teaching people right in the aisles of the store where they normally shop, does work. So it increased DASH score by 4.7 points compared to not doing it. And because we hit on that, we were allowed to test what is the independent effect of online shopping, home delivery, all these nutrition apps. And it turns out that works too. So it's a great story that just sort of shows that these things that are only available if you partner with a company like this have independent effects, and they're like additive. So it's really, really cool stuff. The between group differences didn't persist at 6 months. We did look at secondary endpoints, pre-specified secondary endpoints. And there, we saw blood pressure, weight, so forth went down, but none of the between group differences were significant. And a lot of the sort of the reductions also were not significant as well. But the important point is, this was never really designed to look at those things. This was really designed around dietary quality. So in the future, we can design trials that really sort of focus on those key things. And the reason I sort of mention that is if you're going to do a blood pressure trial, you have to have a lot of very, very good medication adherence assessments, which is not something necessarily a dietary intervention trial is going to invest the participants' time on. But obviously, if you wanted to do that, then you would make that investment. So there will be some study design tweaks that then happen when we move on to those other outcomes.
Awesome. Thank you for explaining that. So now just mention one strength of the study and then one weakness of the study to share with our listeners.
Yeah. So this was actually brought up by Dr. Douglas. So a strength of the study is that there is an economic engine to make this sustainable. Okay. So she brought up a trial. It was called, I don't want to quote exactly, but it was Hypertension Management in Black Barbershops. Did you all read that? It was in New England Journal of Medicine. It's an amazing trial. There, the interventions were set up by the study. But of course, then after the study's over, those interventions don't necessarily continue on because where's sort of the revenue stream? Where's the part that sort of keeps it sustainable? What's amazing about this is retail-based care is already out there, right? Kroger's already been doing retail-based care. Walmart, Amazon, they're all doing it. What we are doing is just providing the research to guide it. And if the reality is, as you all sort of know, if you can have great data that shows something works, well, then payers and others will support it. And so there's a mechanism for sustainability here where the retail clinics can provide this and, of course, scale it. And what's the magic of retail? Well, retail is embedded in every community, really anywhere you go in the world. If you're rural or urban, if you're East Coast, West Coast, if you're in the US, Europe, Africa, Asia, wherever you may be, retail is embedded in the fabric of your community. And so this provides a vehicle now for scalable solutions for a whole variety of public health issues, not just in the US, but globally. I mean, that's the magic here. It's like, how are we going to get findings from trials out to people and help people live better? And no matter sort of where they are. That's the magic here. Now you have this enormous industry that's tasked with that. And here's the other way I'll sort of explain it for you, and I look at it this way. So when you hear a new drug trial being presented here at ACC, realize there is a manufacturer behind that, right? There's a company that's going to produce that drug. It's going to make it safe. It's going to make lots of it based off how often it's prescribed. Without that manufacturer, you can't, universities don't make drugs, right? We can't, University of Cincinnati, where I work, we can't produce a new therapy for everyone who needs it everywhere in the world. I mean, we simply don't do that, right? And that's the problem, I think, what community health projects have struggled with is they can do this great sort of science the way like a university basic scientist can do science, but then who's going to take it and who's going to manufacture or deliver it and then disseminate it? Now we actually have a partner. I mean, this is an inflection point and what will become a huge evolution to healthcare system that you're going to see across your careers.
Absolutely, thank you, and I totally agree. Based on the data that you all presented to us, and what I really love about the study is that you individualize, the patients based on what they shop for, to make it more practical, and then you took the data and presented it to the patient. So constantly educating the patient on their practices and what are some things that they could do based on their speaking with the dietitian in order to decrease their cardiovascular risk. Thank you so much for taking the time out to talking to these listeners and explaining the study that you conducted and the outcomes and things that you all found with the data.
Well, thank you, and to all you listening, you can do the next great trials. So whatever you're passionate about, go for it. There's a lot of big questions that need to be answered, and work hard and get some of these answers.
Thank you so much, Dr. Dylan Steen. And for those listeners out there who wants to learn more about, emerging trials that are underway and that have been conducted, please follow the YouTube channel Fits on the Go.